Good evening, everybody. We'll start with today's session with another new remedy. We have finished, I think, so 5 remedies up till now: Alimsipa, Euprasia, and then 3 injury remedies, and we are continuing with the injury remedies only. Today, I will going to share one of the very useful remedy in our day-to-day practice. In fact, I can share maximum cases with this remedy. It's a wonderful remedy that is Symphytum Officinale. I will start with the case first. First case, young fellow who was my regular patient who become young and got a job in Pune. He was a youngster, 24, 25. And when he was Pune doing the job, he used to play every Sunday cricket. And one day he got an accident. The gut ball directly hit his left eye, and there was an eye injury. The vision was lost temporarily, and he was taken to the ophthalmologist. He observed, and he has done some local dressing, and he said that keep this for a day next, and called him next day. And when he opened the eye, the vision was obscured, and he said that you have to go for an operation. This fellow was he frightened a lot because he was alone in the Pune. His whole family used to remain in Sangamner. In fact, he was not having father, only the mother. So he called me from there and he said, "This is my up." He sent the picture of his face and it was black eye with a lot of injury over there, redness inside the eyes over there. And he said, "Vision is lost." So this fellow came to, I asked him to do come Sangamner immediately. He came same day. Next day he was there with me. I saw his injury and I have prescribed him 3 remedies. First, I have given him arnica along with the symphytum because there was an injury to the eye internally also, directly to the cornea. And along with that, I have added the calcarea phos for the healing purposes. And I asked him to keep the eye packed for another 24 hours. Do come next day. We'll see what happens to the vision. And he was not able to recognize the fingers. I asked him how many fingers are there. He was not able to recognize, that much vision loss was there. So it's a risk to treat such types of cases, but I was sure about Symphytum. I was sure about Arnica. So I have given him Arnica 200, Symphytum 200, and Calcarea for 6x TDS. And next day he came and he said that I got good sleep. The pain was much reduced. And next day when I opened the eye, yes, black eye was there. The redness was there, but he was able to recognize me. I kept him this hand. And how many fingers are there? He said, yes, 5. The vision came back. That is very important because this is the main function of the eye, vision. If it comes, forget about rest of the things. The patient will going to get cured. I'm damn sure about it. And I was. So I asked him one more day, you keep that because it is a healing process which happens if you keep the eyes open many times, the secondary bacterial infection can lead to the keratitis. And once keratitis happens, it can leave with a scar. So it should not happen. For that purpose, I asked him, keep it closed for a day, take a rest, and next day we'll open that, and then thereafter no more dressing is needed. So I have given him I have continued the same prescription, the arnica, symphytum, and calcarea phos for a week. And when he came after a week, he was absolutely having a normal eye. Only remnants of black eye, those were there, and it takes nearly about 3 weeks to heal completely the black eye. That that is normal because the blood which stagnates over there around the eye, it gets absorbed gradually. It takes period of 3 weeks, and he settled completely. I asked him to show to the same ophthalmologist who asked him to go for operation. And he went to the Pune and really he met him. And he was seen by that same fellow. He said, how can it be possible? He said, I took the homeopathic treatment. He was astonished after seeing the result. So this is the importance of the symphytum, specifically the optic injury to the eye. It has been very specifically mentioned under the symphytum that it is an injury to the eye when a feeding infant has a fist and it struck the mother's eye. This is the wonderful remedy to be utilized for that purpose. There are three important remedies. First remedy, always I used to use the arnica. First remedy, because extravasation of blood to absorb that is the arnica. Second important is the if there is a problem with the eyeball, and especially in the outer chamber, if there is a bleeding, that time it is the ledampal which you can use. And third remedy is symphytum. These are very important remedies. One might ask calcarea phos why it is needed. Calcarea phos, any type of injury where healing is needed, this calcarea phos plays a very vital role. Calcarea phos stimulates that healing process in 6x potency because it works at the molecular level, and rather it stimulates the process of cure, and that's why I have added the calcarea phos. So this was a very good case in my practice where I saved the patient's operation who was young enough to go for surgery. Second case, which was there with me, the fellow was my old patient of AVN, avascular necrosis of left femoral head, and he was cured. In fact, he stopped treatment 2 years before 2 years. And one day there was a call from him. He said, Sir, I want to meet you. So I asked, what has happened? His name was Praveen. What has happened, Praveen? He said, Sir, I had an accident 6 months back, and my same leg, the femur shaft has fractured where I had IVL. So immediately I was taken to orthopedician over here. Then I was shifted to Pune and they operated twice and they took a series of X-rays. But after 6 months, they are saying that it is not healed. And they said that you require third more operation because callus is not getting formed. We'll do the bone grafting for that. And that's why I thought of you and I called you. So I asked him, do come Sangam. Then he came with a walker and he was there in front of me. I took his case. Here, again, the same prescription which I have used in case of the first case, I have used the same prescription, but here I have repeated it for longer time of duration. I asked Pramchit, don't go for operative. I'm damn sure your bone will heal. He said, how can it be? The doctor is saying that you will require bone grafting. He asked, do you believe me? He said, yes, you have saved me from avian surgery. Then wait for 2 months. Ask them that I will wait for 2 months. If callus is not pumped, then we'll go for surgery. And then he talked with he was having very good relations with the doctors, in fact, even in Pune. And he talked with same doctor and he told him that after 2 months, we can go for surgery, plan surgery if callus is not formed. And I'm taking some homeopathic treatment because of which my avian was treated. Doctor asked him, okay, no problem. And then because already the nail was there inside. So I have started him Arnica 200, the Calcarea for 6 and Symphytum 200. And it was repeated twice a day for 15 days. Along with his own remedy. His constitutional remedy was lachesis. I have treated him for avian with lachesis. So I have given 3 doses of lachesis followed by these 3 remedies. It was continued. His pain disappeared completely. He was able to bear the weight. Even when he came after 15 days, he never brought that walker. Instead of that, he took a stick in his hand and he came to me. Then he said, Doctor, I'm able to put a weight on it, which was not possible earlier. And that's why I was using the walker. But now I am able to. I asked him, let it continue. Don't change the remedy. We'll continue it and we'll do it after 2 months only. We'll do the X-ray. And the prescription was continued. After 2 months, when he went to the Pune only, the doctor took the X-ray and he said, Praveen, you have saved for surgery from surgery. Now good callus is good amount of callus is there, and there is no more needed. And after 1 year of completion of your problem, we'll remove the nail. So this is thing. This is capacity of the calcarea fossa and symphytum to develop a granulation tissue. In fact, not a granulation tissue, but to develop a callus. It helps a lot to form a callus, the symphytum, and that's why the name is knit bone. This needs the bone. This is very important thing of the symphytum, and calcarea fossa stimulates this process. So it was second case where the surgery was saved with the remedy. And third case, which was again an interesting case in my practice, where this fellow came to me with an actually there was a fracture of the specifically the maxillary bones, and it was a head injury, and he fall go to face accident directly, and there were fractures over there. Doctor asked that he should go for a surgery, but with surgery we can heal, but there will be a lot of things which we have to correct and etc. And but otherwise his brain was saved. So he was my regular patient earlier. So he called me from the hospital. Sir, is it possible to have homeopathic aid in such types of cases? I said, why not? Because when I went to that hospital to see the patient, I observed one thing, that wherever the injury was there, there was a formation of a tumor like swelling over there. After an injury, when tumor happens at the bony levels, specifically, the symphytum plays a very vital role. It is a wonderful remedy to be utilized in such types of cases. So I immediately started him with same combination, the arnica, symphytum, and calcarea fossa. Arnica, why I used to use arnica is a remedy that clears the soft tissue healing. If there is an extravasation of blood that can be absorbed with the help of arnica, at the bony level, whenever injury is there, followed by a tumor swelling over there, symphytum plays the role. And calcarea fossa heals it in with mm, by stimulating the process. So again, same prescription was followed, and after nearly about 10 days, he was discharged from the hospital without doing the surgery, and his face was quite good, quite good. And then he continued homeopathic treatment for another month, and he was absolutely looking normal after that, and fractured heals clearly without showing anything over there. These were three important cases where I have used the symphytum. There are many more to share because we used to use that remedy off and on when I was there with Bagli sir at Pune. I used to use this symphytum off and on in every case of fracture. But I used to follow one order. First, I used to give the arnica. Then there was a reduction of fracture or all those things have been happened. And then once alignment is fixed, then I used to give the symphytum. Because this is the method which you have to follow. If you start symphytum directly, it heals in the same position and there will be a deformity, which we should not develop. Because it heals, but it heals with deformity. That is not needed unless and until the fracture is reduced. You have to reduce it. So this is too important. All these three remedies, yes, Amit, tedious or twice, that depends upon the case, but I used it and I have repeated it. No, it's not a single dose. Repetition is needed in such types of cases. It is really needed. Single dose is not of any use in such types of cases because here you want the healing completely and you have to stimulate that process of healing continuously. So it works. So there are many more which where I have used this symphytum up and on. So we'll go through the Allen's keynotes. It's very short explained over there. Just go have a look over the symphytum from the Allen's keynotes. We'll read that first and we'll understand what the Allen wants to explain about the symphytum. So let us go with the symphytum. The common name is compre, and it is the Borignaceae family. First sentence of Allen is very important. Facilitates union of fractured bones, and he has mentioned over there calcarea fos. Calcarea fos in biochemics 6x helps in a different manner. It works at the molecular level. So calcarea force I never gives in dynamics in such types of cases. I used to give it in semi-dynamics, that is in molecular level. When we use the 6x, it is molecular. Lessens peculiar pricking pain. That is very important. Pricking pain is a characteristic of symphytum. Favors production of callus. See, these things one has to know. Favors the production of callus when trouble is of nervous origin. So there are pains, there is injury to the nerve, there is injury to the bone, there is a fracture of the bone, and to develop a callus, symphytum plays a very important role. So this remedy is a wonderful remedy in order to heal the bones, bony fractures. Irritability at the point of fracture. That means there is a severe pain, irritation wherever the fracture is there. Just now I am treating case of fractured neck femur. Um, and fellow is 90 years of age. He had the fractured left-sided neck fever along with the left humerus. Two, he was 90 years, fall down and developed this. So he was operated, but there was where it has been told to him that it is very dangerous to operate and all those things. I asked him to start with the medicines, and he was there and he was operated successfully. And now 15 days have been passed, and he is good and he is walking with walker at the age of 90. So this is wonderful remedy in fractured cases. Periosteal pain after wound have healed. So after wound have healed and there is a periosteal pain is there, it persists after that. The symphytum is the remedy. The two remedies comes closer. Here, ruta plays also very good role. If the pain is persistent specifically in shin bones or wherever the soft tissue is less and pain is periosteal pain is there, ruta along with symphytum is the best combination to be utilized. Combination means you give symphytum separately and ruta separately. Ruta in high potency 1m, 10m, symphytum in 200 is sufficient. Mechanical injuries like arnica, blows, bruises, thirst on the globe of the eye. This is the globe of the eye where the injury is there, and symphytum is the remedy in such types of cases. Arnica is not the good remedy. Arnica is for extravagation of blood, which happens around the eyes. But eye injury remedy, think of symphytum first. Pain in eye after blow of an obtuse body. So a sharp body which happens to be there. Snowball strikes the eye. That is another thing. And I have shared a case. It was a wonderful case because that fellow believes me a lot because he was saved from the severe operation of the eye. Infant thrusts its fist into the mother's eye. This is very important. And this happens when they feed the baby in lying down position. Their infant's hand goes toward the mother's at that time, and that injury happens to be there to the eye. To the soft tissues around the eye, arnica is the remedy. That is the comparison. Remedy where the soft tissue involvement is there, arnica. If it is bony structure injury is there, symphytum and ruta. For the healing fracture, symphytum. For pain, ruta is very important remedy. So we have to understand exactly where the remedy acts. The site of action, the exact place, it defines you remedy in such a manner. It is a very good remedy in spinal cord injuries. Whenever the fracture happens to be there with the spinal cord, it is wonderful remedy to be utilized for early healing. Because what has happened, if there is any fracture to the spinal cord, spinal canal, spinal cord, then what happens? Any vertebra is fractured, the only treatment is ask the patient to lie down in bed for at least 2-3 months because that is the only thing with which patient is immobilized and then it heals. But problem arises for early healing. If the patient lies down continuously for longer time of period, he develops secondary problems like pneumonitis, or patient goes into complications because of that. We can prevent that by early healing with these remedies. So Symphytum along with arnica plays very vital role, along with calcarea phos, it plays wonderful role. What he mentions about the relationship. Compare arnica. Already we have discussed arnica in length. Arnica is specifically for the soft tissue injuries. Arnica is for to absorb the blood. Arnica works as a hemostatic. So it is a wonderful remedy. Calendula has a capacity to develop granulation tissue. So if injury, open injury is there, to develop, to heal that with the help of granulation tissue, it is the only remedy which stimulates the granulation process, and even big space is there that can be healed with the help of calendula. Calcarea phos, whenever the injury is specifically to the bones, calcarea phos, it is one of the important part of the callus. And that's why it is one of the important remedy to be utilized in such types of cases, because it is a remedy for degenerative process as well as regeneration. It takes the part. Calcarea fluor, then fluoric acids. Fluoric acid for the degenerative purposes, whenever bone injury happens and followed by degeneration, fluoric acid, calcarea fluor, these are remedies which we can use. HEPA, yes, definitely. To prevent the infective focus over there in compound fractures, HEPA and silicia do a wonderful work. I used to utilize HEPA in high potency, but generally silicia in low 6x biochemic doses. HEPA not too much doses, 1 or 2 doses. It prevents the separation over there. And silicia, if any foreign body is there, silicia promotes to throw it away in 6x potency. So I used to use silicia in biochemics in such types of cases. It follows well after arnica. So after arnica symphytum, very important if bone injury is there, fracture is there, for pricking pain and soreness of periosteum remaining after the injury. One remedy I want to add over here is the ruta. Whenever the periosteal pains are there, periosteal injury is there, ruta is a wonderful remedy to be utilized. So this is what Allen gives about the symphytum. You can read it from the Boric also, so that you can understand little bit more about the symphytum over there. So just open, if you have Boric, will have just a view over symphytum, what he says over there. All other things are there, but first paragraph is very important. Symphytum compre need bone. Need bone because it heals, it needs the bone really. The root contains crystalline solid that stimulate the growth of epithelium on ulcerated surfaces. It may be administered internally in the treatment of gastric and duodenal ulcers. Also in gastralgia and extremely in pruritus ani. Injuries to sinews, tendons, and periosteum. Acts on joint generally, neuralgia of the knee. It is a very important remedy in knee injuries. Whenever there is injury to knee with arnica, you can go for symphytum or a ruta. Of great use in wounds penetrating to the periosteum. There it has been written perineum. It is periosteum and bones. And non-union of fractures. Irritable stump after amputation like LMC, hypericum, ledam. This is one more remedy to be added. Irritable bone at the point of fracture, psoas abscesses. What is psoas abscess? Psoas abscess is cold abscess which develops at the paraspinal muscles, and it is because of tuberculosis of the spine. In tuberculosis of spine, one important remedy which I have already shared with you is the Drosera. The Margaret Tyler, she has written a book on Drosera, and where she has discussed many cases of tuberculosis of spine, which is also called as pot spine, treated with the Drosera. So along with Drosera, this remedy plays very vital role. So as abscess, pricking pain and soreness of the periosteum. Then head symptoms, pain in occiput, top and forehead, changing places. Pain comes down bone of the nose. Inflammation of inferior maxillary bone. Inferior maxillary bone. This is the area. If injury is there, the tumor is there, there is problem over there. This remedy is very important. Inflammation of inferior maxillary bone, hard red swelling. Eyes pain in the eye after blow of an optic injury for Traumatic injuries of the eye, no remedy equals this. Underline this. This is what Borik says. And he has mentioned same remedies for comparison, and he has mentioned dose, the tincture. But I used to use the internally medicine. I used to use the 200 potency. I have never used Symphytum mother tincture, even not for local. Dr. Murphy, he has mentioned one thing, that this remedy in the mother tincture form or as a herbal remedy can be used at the herniated sites, and hernia can heal. That was his experience. I have not tried. Externally as a dressing for sores and ulcers and pruritus ani. Yes, this is a wonderful remedy for pruritus ani. Because of pinworms, Symphytum plays very vital role. So that's all about the Symphytum, a good short remedy, but very, very, very useful in your practice, and which builds your practice. So we are discussing about all those remedies in sequence, and all those remedies which have closer relationship with one another, and which are very important to understand, because we can differentiate at the clinical level because of this. So we'll learn one more remedy tomorrow closely related with it, and same is there in the second year syllabus, the ruta. We'll go to the ruta because it is closely associated with the Symphytum. Tomorrow's session will be for the ruta. So thank you being there. Many people who have joined for different areas. Thanks a lot. And ask your friends to join to learn the Materia Medica in this manner, so that you will never forget and you'll get the clinical aspects of the Materia Medica. So thank you. Thank you being there, Satyanaranji and
Thank
everyone.
you, sir. Thank you, sir. Thank you,
So
sir.